Hello, you are watching McLaren Port Huron Today's Health Program. I'm your host, Kelly DiNardo. In today's program, we're going to be talking about obesity in women, and joining me is board-certified General Surgeon Dr. Karen McFarlane. Dr. McFarlane, thanks for joining us today.
Thank you for having me.
Let's talk about the obesity rates in women and just across the U.S. in general.
Well, according to the Center for Disease Control, or CDC, in 2013 we have over 160 million Americans who are either overweight or obese.
So how is that defined? I think we have a chart that actually breaks it down.
Well, that all actually designed from the National Institute of Health. And what it's really based around is a number based on both your height and weight. So we do have a chart that I'm more than happy to go over. So your body mass index, based on your height and weight, we get a certain number, and that magic number is 25. So anyone who's overweight is a BMI of 25. That's usually about 25 pounds or more overweight. Obese category, you're looking at least about 50 pounds overweight. And then we go into severity of obesity. Morbid obesity, we call a BMI of 40, you're looking at between 80 to 100 pounds overweight.
So do we know the number of women that are affected with overweight or obesity?
Absolutely. So when we include overweight, including obese, we're talking about 75 million women.
Wow.
All right. And then we actually can piece out a compartment of that for those who fall into the obese category. You're looking at about 40 plus million or so.
So why do you think we see this, are seeing this increase?
Well, part of it is our culture. Our culture has become very, very comfortable. For example, how many people really actually walk to get to the supermarket and get their groceries? So we become what we call a sedentary lifestyle. We're not exercising as much. Our foods are very convenient. There's a lot of fast food options, and what we don't realize, processed foods are actually taking away our very health.
And we see a lot more of that, I think, just for processed foods, of course, stay on the shelves a lot longer.
Absolutely.
A lot more convenient.
And there are also ingredients that have changed. So many of our foods are more sugary. And even though, be very careful about fat-free foods. For it to maintain its taste, they actually have to substitute that with sugar. So even though you think you're doing yourself a service, it's really a disservice.
So how do you help women maintain a healthy weight? What are your suggestions?
We can go simple. I mean, of course, some can go a little bit extra where you can, I think they have organic options for meals now, which sounds pretty awesome. But really just go back to the basics. Eating fresh fruits and vegetables is very important. Staying away from processed foods. I understand many of us either live alone or don't really have that much people to cook for. You go for the Stouffer's lean cuisine, but that also has a lot of salt. And salt also adds to your weight as well.
So these, I'm sure you hear a lot about different fad diets. So what's kind of your suggestions when a patient asks you about the cabbage soup diet?
So, first of all, to even qualify for weight loss surgery, usually you have to demonstrate that you've tried. So we do inquire whether you do Atkins diet, Jenny Craig, Nutrisystem, etc. But all of those have their own cost. Some of them are pretty prohibitive, $300 to $400 a month. I mean, that's a really high grocery bill on just one person. So again, your healthy option is as simple as getting your fruits and your vegetables. Really, when you think about it.
So kind of start small changes. And
small changes make a big difference. Many patients tend to fall into the temptation of carbs. And carbohydrates are something like pastas, breads, or even sugary beverages. I'll be honest with you, I'm a pop drinker, but once you nix that out your diet, you'll be amazed how much weight loss you get alone.
That's great. So what are some of the health risks that are related to obesity in women?
Too many. Not only is there risk for high blood pressure, we call it hyperlipidemia, diabetes is on the rise. We also have sleep apnea, so there's a profound difficulty for sleep. Sometimes some women are told, hey honey, you snore. That's also part of the syndrome. Depression is part of it. Cancers are increased 5 to 10 times in women who are in the obese category. And that's just to name a small few.
So how does losing weight help reduce those risks? Well,
the great thing is you have a potential chance of really reverting 70% of that or put it into remission. We do find even a 10 to 20 pound weight loss can help your blood pressure. Okay, your cholesterol profile gets better, so we call it improvement of your hyperlipidemia. Your diabetes also improves, not to mention your joints. Even a 20-pound weight or a 20-pound bag of sugar, if you try to put that in your hands, you're like, this is pretty heavy. Imagine what this is doing it for your joints.
So even starting small then, I think of the analogy, if you think of a quarter of a pound of butter, that's a lot when you look at it, you know.
But actually butter makes things taste good.
Mm-hmm. And it's healthier, right, than some of the saturated fats and all those things.
Yeah, and actually in the past 2 years, even the federal government has made big changes on that. So for example, excluding trans fats in diets. And actually it's not just for weight, it's also for what we call your cardiovascular health. So it's helping your heart too.
This is a lot of great information. We do need to take a little break, so we'll continue our discussion in just a few moments.
Thank you.